Welcome to Commercial Real Estate Unfiltered, the podcast that takes the mystery out of commercial real estate and makes it accessible for everyone. I'm Caleb David, a broker, investor, and community builder with over a decade of experience helping businesses and individuals bring their visions to life. Here we break down the market, share expert insights, and talk about the opportunities that commercial real estate creates for businesses and communities alike. No fluff, no gatekeeping, just real, unfiltered conversations that empower you to navigate the space with confidence. So whether you're an investor, a business owner, or simply curious about commercial real estate, welcome. Let's dive in. Welcome everybody to Commercial Real Estate Unfiltered. I'm really excited today because I have one of my favorite people on the podcast, and the work that she's doing is absolutely incredible in Uganda. And I think it's important for people in real estate to get involved in their communities, get involved in social justice, and to make a difference in the world. So today's guest is Jess Wiederholt, and she is the founder and executive director of Crazy Love Africa, of which I am actually a board member now, a nonprofit that empowers women living with HIV in Uganda through micro business grants and holistic community development. With a background in child and family therapy, Jess is a fierce advocate for social justice, sustainable impact, and orphan prevention. Her work focuses on creating opportunities for women to thrive and survive through empowerment, education, and most importantly, love. Jess, welcome to the show.
Thank you, Caleb. Thanks for inviting me.
Absolutely. I would like to tell people how you and I originally met. We met virtually through Facebook. Both of us have kids adopted from Ethiopia, and we became friends, I think, before I even moved to Colorado. And Jess is based here in Denver, and so I moved here in 2012. And then we'd see each other at random events, like maybe once a year, if that. But we just stayed in touch over time on Facebook, following each other's adoption journeys and also the nonprofit journeys. And so, Jess, maybe share a little bit about Crazy Love Africa. And I know microgrants is a huge part of what we do. So if you can maybe just share to our listeners, what is a microgrant? How does it work with Crazy Love Africa? And how does that benefit the women that we serve?
Absolutely. Yeah, thank you, Caleb. It's always so important. Community, right, is so important. And I'm love the way that we met like-minded adoptive parents. So it's great. I came into this nonprofit through adoption. Our travels in Ethiopia and Uganda, we saw the injustices around women living with HIV, specifically mothers living with HIV, and they were dying not because of the virus, but because of the stigma around the virus.
Mm.
And that was really hard for us to accept that our four children lost their mothers because of stigma,
Yeah.
because of HIV. It was a simple little gesture 11 years ago when we're like, oh, for the holidays this year, we're going to do a micro business grant for a couple women living with HIV to show them that through empowerment, through believing in them, we can help them get ahead, start a business, provide for their children. And we're amazed at how well that worked. Like we knew, like I had done my homework, right? I had read a couple books, but right, firsthand knowledge, watched how that changed the women's lives by $500 grant to be able to start a business and to be able to send their kids to school and help them out of poverty.
Yeah, that's incredible.
Yeah.
And there's definitely a ripple effect, right? Like maybe explain how empowering one woman
Yeah.
affects the family, the community, etc.
We can start, I can use a name. So Susan, we gave her a micro business grant, and her business proposal was to start a secondhand clothing shop. She had some background in it. She had one son. She was living with her extended family, which is very common, right, for families to rally around each other and live in one compound. By her starting that business, also getting training and business skills, joining a community of women, becoming a leader, starting get training and making artists and crafts, like all of these different things that in our program, she was able to help her family build a home in
Mm.
her compound. They now live in a secure home where rain doesn't come through, and that helps with their health. And as well as she has also used her skills to become a social worker. When we
Wow.
met Susan, we didn't know she had a degree in social work
Wow.
because there just wasn't opportunity for jobs. So Susan now has built a home for her family. She has become a social worker. Her kids are going to school. Her extended relatives are able to go to school. as well as Susan has been able to mentor other women,
That's incredible.
right? To see how that just, it starts with one woman, it affects the whole family, and then eventually just a village.
Yeah, and you and I are so like-minded in how we approach the nonprofit sector because I've been in it in the past, and it's just been such a joy to come back into it with such a great organization. But I think the thing, and I say this on other podcasts all the time, they're like, when I'm guesting on a podcast, they say, "What did you take from your nonprofit world to bring into how you do real estate now?" And
Mm,
for me, it was very simple. It's a very simple. It's when we treat people with dignity and respect, and you believe in them,
yeah,
incredible things happen. Because this is not about a charity handing out money, just handing out food. This is in the like on the ground doing the work. And in fact, you have a full Ugandan board, correct?
exactly. Yeah, we have Ugandan staff, Ugandan board, and it's empowering them to do that work, right? They have the skills,
And
right?
yeah, and they understand the community, the culture. So how does that relate to when someone wants to support an organization like Crazy Love Africa? Like, why is it important to have people on the ground and a board on voices from the ground? And how does the US board interact with that board?
Absolutely. Yeah, I don't know if you noticed, Caleb, but I am a white woman. Did you notice?
I noticed.
So, how things happen here in the US are not most of the time not helpful to folks in Uganda.
Yeah,
So, it's really important for us to listen to what the needs are. And that's what we've always done from the very beginning. And that's why it's grown to such a beautiful program. So, it's like we'll get together with the sisters and say, okay, the micro business grants have been great. What else do you need? What else would be helpful? And they immediately said, we need community, we need a safe place for the sisters to gather. So that came next. And so it was like listening to the leadership of the women who are benefiting from the program to create the program. And to have a board, obviously, when you're a nonprofit, you need a board, right?
yep,
So it was really important for us. We have to have a US board, right, for our 501(c)(3),
yep,
but it was really important for us to really be guided more by a Ugandan board who understands culture and the needs of their people.
yeah,
And our job, the US board, right, Caleb, is to listen to what they need and say, how can we best support you?
absolutely. I love
Yeah.
that because it's very much again about the respect and dignity because and humility on our part that we need to approach a different culture in an issue that needs to be humanized. And who better to humanize it than the people that are living there every single day? And so you talked about community, and I know you're getting ready to leave in just about a week or so to head
Mhm.
to see the new community center. So talk to us about the community center, where it's at, and what it'll be used for.
I am so excited.
Yeah.
This will be the first time we've been working on the community center since 2020. That's when we bought the land. And so it's been this long time dream to have our own space. Before we had a community center, the sisters would just meet at each other's homes, which is beautiful,
Yeah.
right? They would travel
Yeah.
to each other's homes. But as our sisterhood grew, there was not enough room in their homes, as well as when it rained, it's hard to meet outside, right? So we
Yep.
know we needed a space. We really wanted to have a place where they could sell their crafts as well as a place where they could make a little bit more income. I bought the land in 2020, and last year we opened the main floor, which is the gathering space for the sisters. So that's where they meet for their sisterhood support meetings. That's where they meet for their trainings, as well as the kids that are in our program for all the services that are provided for them. So the main floor is open. It's a beautiful space. And of course, we're still adding it and making it our home. And then on this trip, we will be staying in the apartment that has been built on in the downstairs.
That's awesome.
So this will be neat. It'll be a great place for any of your listeners who want to come over and learn a little bit more about Crazy Love Africa, want to learn about Uganda, can actually stay at our community center. We're going to be renting it out like an Airbnb type of space,
Ah,
as well as the top floor. The top floor will be apartments. So our sisters will be managing this community center, and the funds that they make from it, right, will help run the programs there in Uganda. So talk about empowerment, right?
absolutely.
This is their home, like
Yeah.
their community center from first floor to third floor.
I love
So
it.
it'll be amazing.
That's incredible. So how many sisters are currently in the program?
Yeah, so we have about 26 sisters in Uganda. We do have some sisters in Ethiopia too, because we worked for there for a little while too. And then we're hoping to bring on about 15 more sisters still this year. So.
It's awesome. And how many kids are affected by the program?
Yeah, there's a little over 50 kids in the program right now. So each of the kids, they're the children of our sisters,
Yep.
and they're all single mothers. And so they each have a sponsor here in the US that helps send them to school. A lot of people don't realize, but it's pretty expensive to go to school in Uganda. It's
Yep.
not free.
Yep.
And so a lot of them weren't able to go to school beyond what you would primary grade,
Right.
especially when you go into the high school grade, secondary school, it's very expensive. So by providing a sponsor, we're able to keep these kids in school. Some of them go on to technical school, some of them go on to college, university.
Yeah.
And yeah, it's pretty amazing. And those kids are a part of the program and so lively and engaging, and it's so fun. It's a beautiful family.
Yeah, and I think the thing about empowerment is that it has a multiplication effect. And I think, gosh, if you're in commercial real estate or any business, this is how you build legacy, right? This is how you make a change that will go generation to generation, even long after we're gone.
Yeah.
And I encourage people all the time when they're looking for organizations to support, sponsor a sister, sponsor a child for their education, which we are in need of. So we'll have notes in the show notes and all of that so people know where to find you, where to find the incredible artisanship that comes from these sisters so that they can buy the baskets, all the different things. But I think it's just the idea of building community is an everyday thing. It's not special to the nonprofit sector, but when people are looking for a nonprofit to support, this is the kind of work that I am so passionate about. And you get to know the organization, you get to travel and meet the people and come alongside of them. You're not going there to do them any favors, you're going there to learn. And it's these smaller organizations that are doing that day-to-day hard work, not some big corporation. If their budgets are in the multi-millions and millions of dollars, you
Mhm.
need to take a look at what the admin costs are, how much is actually going through to the beneficiary. And there's hurdles all the time. We've recently, with the current administration, come across a big problem
Mhm.
directly affects our sisters and their children in Uganda. And
Yeah.
this is all over the world. And we're talking about the cutting of US aid.
Yeah.
And it's, what does this crisis mean for the women and children in long-term HIV care?
Yeah, it's huge. Uganda has depended on USAID for a very long period of time, and about 80% of their meds for HIV, which are called ARVs, are funded through PEPFAR or USAID. So when that was cut off, they stopped making the meds.
Mm.
Stopped making the meds, and they sent everybody home, right, that was working there through USAID. So it's a scary time. As you can imagine, do you remember during COVID when we all were like trying to go get toilet paper at the grocery store, right? We were really
Exactly.
scared. So when people were fearing that they wouldn't have their meds for HIV, everybody was going to the pharmacy, and those who had the means were buying the meds. Those who don't have the means are left with, when will it run out?
Mm.
So what Uganda has done so far is they have reduced the number of places where people can find their medications, and they have reduced the number of bottles that you can get. For example, I might go to the pharmacy and be able to get a 90-day supply of my med. So now they're only allowing people to get 30-day supplies at a time, which is very scary and also hard. If you
Yeah,
want to live in a village very far away from the central pharmacy, you have to really plan to be able to get your
right.
medications.
Yeah, not to mention the time away from work, the loss of income,
Yeah,
you're away from your kids.
yeah.
And it's really heartbreaking. And there's a direct connection, I would imagine, between funding and survival.
Yeah, absolutely. Absolutely. Most of us all know what happened during the AIDS crisis during the 80s and 90s and the millions of people that we lost. So they're already predicting millions of people lost
Yeah.
due to lack of not only just HIV meds, but right, all the other vaccines and TB and all of the things that USA has provided throughout, especially Africa. So we're doing what we can to support our sisters right now. We're checking on them weekly, making sure everybody has meds and are taking their meds. We just don't know
Mm.
when meds are going to run out.
Yeah.
That is the
And
fear.
that's not even the first hurdle. You mentioned at the very beginning is the word stigma.
Yeah.
And what is that stigma? Communities in Uganda.
Yeah, absolutely. So it's interesting as long as, HIV has been around, stigma hasn't gone away. Like everybody knows the facts around HIV now. It's a manageable disease, much like diabetes, and people take their medications every day and they'll live a long and healthy life. But still, there's a stigma if, for example, if my neighbor were to find out that I was living with HIV in Uganda, they would tell other people and I would be shunned.
Yeah.
Therefore, I would need to keep it to myself and not tell anybody else. I
Yeah.
may not even tell my children because I
That's scary.
don't want them to be shunned. What happens with couples, which is also really interesting, why all of our women are single, is because they probably got HIV from their partner, but once they told their partner that they were positive, their partner
Hmm.
took off.
Yeah.
That's how bad stigma is in Uganda and many other countries.
Yeah.
So, yeah.
Yeah. It's a breakdown of the nucleus of a community, which is the family.
Yeah.
And very often, and I know this from my work in Ethiopia, very often the
Mhm.
HIV was contracted, yes, from the partner who's been sleeping around. And
Right.
they're coming
Right.
back. And so now you've got a single mom who's
Mm,
left to fend for herself and her kids.
absolutely.
And in such an honor and shame society is in many countries around the world, that
Yeah.
stigma becomes very real, and your belonging, right, is more important than your survival. And
Yeah.
gosh, how
And
screwed up is that?
the women they carry that shame, which kind of goes back to why our community is so important because we bring those women together and teach them how worthy they are, or we don't. They teach each other how worthy they are. And when you talk about dignity, how much they're needed in their community and their families, and that empowerment,
Yeah,
is just amazing.
yeah.
Yeah.
And I think with how much they're doing for themselves, we get to have a seat at the table. But
Yeah.
in this scary time, not just in Uganda, but across the world, what are some things that we can do to advocate? And what are
Mhm.
some things that community leaders can do right now
Yeah.
to try to help meet these needs?
Absolutely. One of the things that I have personally been doing weekly is calling my representatives. Hi, it's Jess
Just
again.
again.
I know the staff at each of the offices really well. Hi, Jess. It's really, even if your representatives share your beliefs, so my representatives share my beliefs about USA, they're very supportive of it. I still need them to hear the stories, and they need the stories. They
Yes.
need to know how it impacts people here in the US,
Yes.
people internationally, and how important it is to us. So I
Yes.
share some very personal stories with them. So that's important. I sign a lot of petitions, right? Besides just making phone calls as well and supporting organizations that are doing the work. So, like Crazy Love Africa, we have an emergency medical fund. So, and that fund right now is used for sisters when they need to go to a hospital or a doctor appointment, and the cost is more than they can manage. But that medical fund will also help us when it comes to the time when we're not able to get free meds,
Mhm.
we're going to have to look elsewhere to be able to purchase meds.
Yeah.
We don't know exactly where that is yet, but we know we're going to do whatever we need to make sure that the women and children in our program have
Yeah.
the medications they need.
Absolutely. Absolutely. And I think remembering, I think so often here in the United States, we are so focused on living the American dream that we realize that people are living nightmares every
Yeah.
single day. And I think we are so blinded to it because of how we get our news.
Mm.
And for the most part, we're not connected in community in our own cities. And we forget how important community is. And these are women and children that did not make this choice, right? Yet they're
Absolutely.
having to carry the weight of somebody else's actions. And I, I find it so important because I know you allow people to come to Uganda on trips once or twice a year, I think, but how important it is for us to connect with somebody else there. And that's something I would love to see grow as more people come with us to Uganda. Well, speaking of Uganda, how do partnerships with US donors and African communities, that partnership, how does that create change?
Yeah, absolutely. We definitely believe in kind of this global sisterhood, brotherhood model, right? Like we're all in this together.
Yeah.
I was just talking to somebody this past weekend when we were just talking about how HIV is a global issue, right?
Yeah.
Like you can't just say HIV is in Africa and they need to
Right.
take care of it. No, people are living with HIV across the world.
Yeah.
We have to be able to work together to support people living with HIV and help people not be born with HIV and contract HIV in the future,
Yeah.
as well as empowerment,
Mm.
right? Imagine who's my neighbor?
Yeah.
We're all each other's neighbors, and just believing in the global community and the need to empower each other
Yeah.
just to be our very best selves.
Yeah. And this is
Yeah.
something that affects millions and millions of people. And I just read something today that if the support does not come back through USAID, it's up to us to do something about it. This is our global community as well. And I read something today that said that literally millions of people could die if they do not have access to this. And that is, it's a preventable situation and a treatable disease. And we talked about the stigma as well that comes around it. So whatever we can do to help in that regard. And you'd mentioned empowerment. So what role does empowerment play in long-term health?
Yeah. So empowerment is all about believing in oneself, right? And we all grew up having someone, a role model that believed in us, whether it be our mother or father or grandmother. And because they believed in us, right, we were able to do amazing things and it caused our self-esteem to rise.
Yeah.
And so with women's empowerment with Crazy Love Africa, it's a little bit magical. A $500 business grant isn't much in the way of money. It's what comes behind that $500. And
Right.
sisters will tell us over and over again, I've never had someone who believed in me
Yeah. Yeah.
and said, you can do this. And it totally changed that mindset to be
Yes.
like, they believe in me, right?
Yeah.
My sisters here in Uganda believe in me, and I know I can do this, and we can do this together.
Yeah.
And I also want a different future for my children.
Yeah.
So that whole mindset shift
Yeah.
and then that change of wanting something different for themselves
Yeah.
and their children and their communities.
Yeah, so it's creating legacy, it's creating that empowerment is it's changing generations. I know that Crazy Love Africa has had significant impact. It's not a big organization, but how do you sustain impact with the limited resources that are available?
Yeah. A lot of that comes with the community. So we can do a lot with a little
Yeah,
because of just the power of women in community.
yeah,
So it even has been proven by research. If you put women in groups together, they will lead together and they won't let go of each other. They won't leave each other. And then they create change together. They come up with even better ideas for the future in their communities together. And they can do that with limited resources.
yeah,
Like by
yeah,
getting together in the front yard of one of their sisters' houses and saying, what can we do, right, to
yeah,
help our children that are struggling with school? Or what can we do to make a better basket? Or what can we do to increase sales in our business?
yeah.
And that's the magic of empowerment and bringing women together.
Yeah, and I also like to point out that I've alluded to this before. One of the things is that you keep your administrative costs low. You don't have a big building with headquarters or anything like that. It's like the
Yeah,
money, the majority of the money is going directly to the program and to the sisters and their families. And I
yeah,
think that's another way that there can be a huge amount of impact because you are being very conscientious about where the funding goes and hoping to
absolutely.
empower as many women as possible versus building your own little empire.
Yeah. If we could turn my computer around, people always say, where's your warehouse? Where do you store all of the baskets you sell, Jessica? They're behind me in my sunroom, right?
Yes.
So we do, when my kids leave for college, I might move them into their rooms. But yeah, we keep costs very low and all of our funding goes over to
Yeah,
Uganda to really support our
that's
sisters.
awesome.
Yeah.
So, what kind of support systems are essential for breaking generational cycles?
Ooh, that's really good. Yeah. I think a lot what we just talked about, the support systems are community,
Yeah.
right? And safety.
Mm,
So when we talk about women with HIV coming together, it has to be a very safe network
yeah.
because of stigma.
Yeah.
If the neighbors found out that group of women that's meeting on the corner all live with HIV and that got out, they would no longer feel safe. And some of them may choose not to come to the meetings because they'd be associated with these positive
Yeah.
women.
Yeah.
So it's all that's a big part of it is that they need to be able to trust, they need a safe spot where they can talk about these things.
Yeah.
And that goes for a lot of populations where we need safe
Absolutely.
spaces to be. Yeah.
Absolutely. I think it's a human right.
Yeah.
And I think
Yes.
if we can focus on that, because not feeling safe it's about fear and instability. And I think with so much that's going on in our world right now,
Mm,
gosh, how much more important is it right now for us to create safe spaces for people?
absolutely.
Yeah.
Yeah.
And
We
you kind
see
of,
that with our youth as well. We know
yeah,
youth everywhere need
yeah,
safe spaces to be with. We even bring our youth together. All their moms are living with HIV. They don't want anyone to know that. So we
right.
bring our youth together for the same purpose, to have
Yeah,
that safe space to be.
yeah. And then also, you and I have both had similar experiences in that we've had parents of our adopted children who have passed away for various reasons that honestly is preventable. And I think this is exactly why you started doing the work that you're doing right now. But
Mhm.
how does that access to business and education reduce orphanhood?
Yeah. So I always have to kind of take people through a story to help them understand it. Pretend you are a single mother living in a village, a remote village, and she finds out that she's living with HIV. She has to figure out, one, how to get her medications, but she also has to figure out how she's going to get them on a regular basis because we know HIV medications work very well, but they have to be taken every day. And if they aren't, then the body recognizes that and they stop working.
Yeah,
So many of the women in the rural areas often aren't able to get their medications once a month. They're not able to get all the way to that clinic
right.
because of transportation, because of rain, because of stigma. People are asking questions, where are you going? And so many women, because of that, then are not able to take their medications.
Yeah,
And then their HIV turns into AIDS and they
yeah,
lose their life. So, yeah, being able to empower those women to even bring in, right, local pharmacies where women can pick up their medications
yeah,
closer so they don't have
yeah,
to go all the way to the pharmacy and up on a faraway village.
yeah,
So there's so many things that can be done to empower women to say, this is your health, this is how you take care of it. It
yeah,
shouldn't be so hard, to empower them then to be their best selves so they
yeah,
can, it just becomes a normal part of their lives,
yeah.
you know?
And with these grants, that's exactly what that's doing is it's empowering them to create a business that works within their community with the help and
Mm,
support of their sisters so that they have the income and more means to be able to get to those places. And obviously
exactly.
education is a huge part of that, of breaking the
Yeah.
generational cycles,
Yeah.
because I would imagine many of the women in the program don't have a high school education. And so this is literally a generational cycle that is being broken.
Yeah.
And with that education for their kids,
Right.
gets them that much farther ahead than they would have been any
Exactly.
other way.
When the women come into the program, in addition to the micro business grant, they also are receiving HIV education.
Yeah.
And they're having a social worker come to their home and to go over those things every time. What is your medication? How often are you taking it? How are you getting it?
Hmm.
And just going over how important it is.
Yes.
And they're all doing this. And then they check on each other,
Yeah.
right? The children in my house, they all take medications, right? We all
Yep.
remind each other to take our
Yep.
medications. And we also try to find a child, an older child in the house that also can remind mom to make sure she's
Yeah.
taking her medications.
Yeah.
So we're working together to take care of each other and make sure we all know how important it is.
Yeah.
So,
I think that's the beauty of the community model.
yeah,
It's not just this one off. It's like it is, you're in it all day, every day together. And I think that's the
right.
way we were created to be. And why do you think the global community should care about this mission?
Was one of those things where, right, before I knew, I didn't
Yeah.
had no way to advocate for it because I didn't know about it. So once you know the story, so everyone who's listening to this podcast right now knows the story and they're aware.
Yeah.
That's how we take care of stigma. We get
Hmm.
educated, right? So
Yeah.
the more you're educated about HIV, how to support people living with HIV, but also once you know how important women's empowerment is, you can be like, hey,
Yeah.
I can help with that.
Yeah.
$500 for a business grant,
Yeah.
or I could sponsor a child of a single mother to go
Yeah.
through school. There's so many different ways that you could make a huge difference with a
Yeah.
short sum of money, right? To
Yeah.
really change lives in Uganda.
Yeah. I mean, that actually leads me to one of my next questions, which
Oh,
is as
yeah.
we kind of start winding down a little bit. Obviously, I'm in commercial real estate. I care about this. How can other real estate professionals like me support
Mhm.
social missions like Crazy Love Africa? And you touched
Oh,
on it just briefly, but I'm sure there's
yeah.
more ways that people can get plugged in.
Absolutely. It's interesting because I was thinking about commercial real estate and how we're building a community center,
Yeah.
right?
Yeah.
Like just the impact of having a home base and
Yeah.
having a space for people is just a beautiful thing. So being able to donate to things like that provide community and safety for folks, huge, as well as sponsorship for children is really
Yeah.
great too. So
Yeah.
I know throughout my life, and you too have probably sponsored kids through different organizations. Crazy Love Africa is sponsoring kids in Uganda. They're the children of the women
Yeah.
that are in our program. So they're single moms. And like you said, most of the moms did not finish their schooling. Most of them stopped after primary school. And so to be able to send their kids all the way through secondary school or vocational school, and some of them even university.
Yeah.
We have a young lady who's in nursing school right now, so that's really exciting.
Yeah.
Sponsorship is a really great,
Yeah.
powerful tool too,
Yeah.
to be able to support youth in Uganda.
Yeah. And I think one other thing that we're both working on right now is November 15th, we've got a fun gala coming up. It's a homecoming theme.
Yeah.
And one of the things that we are looking for, and another couple ways that people can plug in, is that we are doing, if you're local in Colorado, or even if you're not, if there's something you want to donate to our silent auction that is going to be going towards this, you can give towards that. You can also, we've got some sponsorships available. I went to the gala last year, and we got to be part of the sponsors, and man, what a absolutely fun night. And now we're going to do a homecoming theme. I think that's just so much fun. So there, we are looking for sponsors there as well. Jess, anything before we sign off that you would like to share? I know you're leaving in just a couple of days to head to Uganda, but any last words?
Yeah, I guess just to remind people that we're all in this together in this world. And every time I travel, I am reminded how small this world is,
Yeah.
right? And that we have so much more in common than we have in our differences. And if there's a way that you can empower a woman or a child through your business or through your family, you should do it.
Yeah,
Yeah. So,
absolutely.
the
We
way
are
to
going
be.
to have all of the contact information for Crazy Love Africa in the show notes. So you guys go check it out, give them a follow, figure out how you want to get involved. And please reach out to either Jess or I. And if you want to talk more about it, or you've got ideas of how you can plug in or your business can plug in, we would absolutely love to be a part of that and partner with you. And so thank you all for listening. Jess, thank you so much for your time, and hope you have the most incredible trip and waiting to hear a great report.
Thank you, Caleb. Thanks,
Thanks,
everyone.
everyone. Have a great afternoon, everyone. That's a wrap on this episode of Commercial Real Estate Unfiltered. I hope you found value in today's conversation and feel more confident about navigating the world of commercial real estate. If you enjoyed the episode, be sure to subscribe, leave a review, and share it with somebody who could benefit from these insights. You can connect with me, Caleb David, and the team at David Commercial Real Estate. Just check the show notes for more information. Thanks for listening, and remember, creating space is more than just real estate. It's about building community. See you next time.